Welcome back. Here's interesting research. Most South Africans are adhering to lockdown rules when it comes to tobacco products that have been banned. A survey by the Human Sciences Research Council has found 88% of people were not able to buy cigarettes. Let's get more details now. I'm joined by Priscilla Reddy from the Human Sciences Research Council. Priscilla, thanks for your time. We appreciate it. This is very interesting because I know of lots of people getting cigarettes on the black market, but you have found otherwise. Tell us the figures.
Okay, so what we did was we did an online survey among 19,000 and 19,000 South Africans responded. This was slap bang in the middle of the hard lockdown level 5. So it was around the 8th of April to the 24th of April. And as you said, we found that 88% indicated that they were not able to access tobacco during that time. 24% who were able to buy cigarettes were from townships and the high-density areas. We also found that cigarette buying was higher among those who were less than 60 years old, among the so-called coloured population, lower educated levels, and in the Western Cape and among males.
That's very interesting to point out. So it was a survey of 19,000 people who volunteered this information, so you don't know for sure whether or not they're telling the truth, right? But let's break it down a bit further when it comes to cigarettes and alcohol use behaviors. What are you finding in that regard?
What we found that was cigarette buying was definitely more prevalent among those people who bought alcohol. 92% of those people who bought alcohol also bought cigarettes. But what's important is that when they were outside their home, they were more likely to not adhere to the social distancing. For example, they were more likely to hug, to kiss, to shake hands, and they were about 2.5 times more than those people who did not buy cigarettes.
Yeah.
And then, sorry.
No, carry on.
Over 40% of those who were able to buy cigarettes during the lockdown came into close contact with people outside their home and with more than 10 people. So as we see, basically the risks just increase as you engage in cigarette buying behavior.
You also looked at social distancing among cigarette users, and obviously all of this research points to what government's saying, that people are in closer contact when they smoke and drink, and your research is showing that as well.
Yes, it happens to show that as well, and we can just report what the data shows, and you know that's what we have and that's what we know. As far as we know, there isn't any other data in South Africa on the same topic.
Yeah. You've also looked at scenarios for contracting COVID-19 out of 8 million youth and adult smokers and an estimated ICU admissions and ventilators for those who actually need it. What's that showing? Because that's very important to point out to South Africans. Government is saying that if we reach our peak at this rate, we're not going to have enough equipment or ventilators to deal with the influx.
So, as you're aware, our Minister of Health has been going across the country trying to do two things, and that's trying to reduce the COVID infection from one person to the other, and the means that we have right now is social distancing. The other thing, he's been applauding people and thanking the healthcare workers and talking about the healthcare system and all the preparation that they've done to try and look after people that get very sick, that get severely ill. And if we look at South Africa, as you indicated, over the age of 15, we have 20% who smoke. That makes 8 million people, right? And if we look at 1% of that 8 million smokers who were to contract COVID, then we're looking at 80,000 smokers. And if we're looking at an estimated, say, 5% of those people who may get infected or could get infected, we would be looking at 4,000 people needing ICUs, needing beds, needing ventilators, and needing ICU level care. So you need a very, very high level of both medical care and nursing care. And needless to say, you know, there are risks for people caring with anybody that is ill. And this is not to say that we want to discriminate against smokers or put them in a different bucket, but it's to say that it does increase your risk of severe illness.
It's good to know and good to reiterate. Thanks for your time and the insight. Appreciate it. Priscilla Reddy from the Human Sciences Research Council.